Every year, the Commonwealth Fund goes ahead and does a test of the different healthcare systems around the world. And we, without doubt, always come out last. Why do we come out last? Because we don't have a healthcare system. We have a sick care system. We have a system that depends on solely on money, a system that is a profit-based system, which means they don't really give a damn about your healthcare. What they care about is using your health as a widget to make somebody a hell of a lot of money. That is what our system is based. That is why you see private emergency rooms coming up all over the place. Investment bankers are creating new funds that take care of health insurance or that take care of creating all these little Walmart type healthcare system. They're not looking at healthcare to help you. They're looking at healthcare to simply make money. And that's unlike the rest of the world. Canada and all these other countries have some form of universal healthcare, some of them better than the others. Of course, the best would always be a single payer system throughout, because again, it's the most efficient, but we don't have that we don't have that here. And we don't have the care. We have the people completely brainwashed into thinking that a real healthcare system, it cannot exist in this country. Something that we really need to mitigate quickly. But I want you to listen to this little piece on MSNBC, and then we'll take it on the other side.
The healthcare system in the U.S. is failing, according to a brand new report comparing American healthcare to 9 other developed countries. According to new data, people in this country die the youngest and experience the most avoidable deaths, even though we spend nearly twice as much on healthcare. Joining me now, former White House Health Policy Director under President Obama and MSNBC medical contributor, Dr. Kavita Patel. I found these results shocking, that even researchers say the U.S. stands out for its exceptionally weak performance. Are you surprised? And if not, how does it manifest itself for your patients?
Yeah, Chris, I'm not surprised, sadly. This is a study that the Commonwealth Fund has been doing over the years, and they compare health system performance across 10 countries, including the United States. And they compare them to kind of like countries, Australia, Netherlands, United Kingdom, France. And when they looked at all of these countries across 5 areas, access to care, care process, administrative efficiency, equity, health outcomes, Chris, it's no surprise that we're ranking very low, if not the lowest in overall performance. It manifests every day with patients. Access to care. Think about how long it takes to get an appointment. Think how long it takes to get in to see a specialist. Add to that if you're on Medicaid. I'll even make it easier. What if you're in Texas? They didn't expand Medicaid. Or Florida, states where they have not expanded access, where we have the ability to do it today. That's why we're seeing these results.
Yeah, just try to get in to get an MRI or a mammogram or, 6 months.
Yes.
Anyway, the report says that the U.S. has the lowest life expectancy and the highest rate of preventable and treatable excess deaths. What are we doing wrong? Can we reverse this trend?
Yeah, I think we need to move from I say this and I take a lot of humility, Chris, because I'm part of the problem. We have a sickness system, right? As doctors and professionals, we respond to sickness. You go to the hospital, you go to a doctor when you don't feel good. Chris, what if we inverted that pyramid? What if we paid health coaches, primary care doctors, pediatricians, people on the front lines, what if we paid them the most? This is sometimes what we see in other countries to prevent illness. And it's just something that we're starting to get a little bit better about prevention, but none of us want to be sick. All of us want to live longer. I want to be active to see my kids grow up, have their own kids. So why don't we start paying for those outcomes? And I think because of the way the insurance system is designed, the fact that we're still tied to kind of year to year, you might change your plan next year. So that plan doesn't know that you want to work on prevention, and that we have such a distance between our providers and our patients. There's a gap between us. Sometimes a physical screen between us. We don't even get to look patients in the eyes. We need to change that equation, and we have the power to do so. I love election years for this because this is a top voter issue. I'm hoping both candidates, Trump and Harris, get to talk about what they're going to do to reverse these trends.
Now, listen to how Patel ends that thing. I love election seasons because that is a time where we can get the messages out of the candidates, and we can also impart messages into the candidate. But what's interesting in the debate where they asked Donald Trump about Obamacare, where he said, yes, I want to kill Obamacare, which is not the best health care, but it's better than what we've ever had before. Well, he says, yes, I want to kill it and make it better. And they asked him, what about a plan? Well, I have a concept of a plan. Well, this guy has been attempting to kill Obamacare for 9 years. John McCain saved us from disaster just before he died by voting the last bill to kill Obamacare down, and he's still with it. But what does he have to offer? No plan. America. Can't you see this man has no plan for neither your health care or your country, our country? Come on now. Now, look, the only healthcare system that's viable, the only healthcare system that works is one where we are all in one risk pool so that we don't have insurance companies cherry picking who they want to have as clients. The only solution is a single payer, non-profit system, bar none. You cannot have your healthcare dependent on the profit of individuals or on the profit of corporations, etc. That cannot work because you never know if your healthcare is dependent on somebody making a profit or what's best for you. Have you been to a dentist lately? Do you really need a root canal, or can they just do a fill-in? Do you really need a crown, or can they just do a fill-in? When you are in a system where profit is the motive for healthcare, you can guarantee that your healthcare takes second fiddle to what really has to get done. Folks, it is time for us to wake up. A single payer healthcare system is our only solution. And what we have to do is force politicians to do exactly that.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead, number 1, subscribe to our channel, and number 2, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.